Alright guys, we'll be talking about Munchausen syndrome, and I didn't actually know that a disease condition like this exists till when I was reading iron deficiency anemia. And I read about a funny part of iron deficiency anemia. They wrote that, okay, iron deficiency anemia can be caused by the individual self-inflicting wounds on their self, okay? So the individual is inflicting wounds on their self, and this is causing them to bleed too much, okay? And this is making them lose blood, and this can lead to what? Iron deficiency anemia. So they said that conditions where the individual is self-inflicting wounds on their self is called Munchausen syndrome. So I was like, wow, I have to actually research and make a video on Munchausen syndrome. So what is a focus? Our focus is to discuss Munchausen syndrome, and it's also called Munchausen by proxy. Understand? All right, still the same thing. Munchausen syndrome is also called what? Factitious disorder. Okay, and don't worry, this picture looks tempting. All right, but let's go into the lecture. This lecture will teach us more. Okay, so this Munchausen syndrome is also known as what? Factitious disorder, and it's a psychiatric disorder when an individual fabricates or induces symptoms of illnesses, often to gain attention, to gain sympathy, or to gain medical attention. All right, probably they're feeling like they're benefiting, all right, but it's right from the psychiatric well-being of the person, though, right? Because an individual that is normal will not really uh, fabricate or induce symptoms of illnesses on themselves, right? So, guys, people with Munchausen syndrome may do one or more of this, all right? They can feign symptoms like pain, seizures, or difficulty in breathing. They can tamper with medical tests or instruments to produce abnormal results. They can self-inflict injuries and illnesses. And this is the point that actually led me to know that there's something like Munchausen syndrome. Okay, then also these individuals can lie about medical history or previous illnesses. Okay, and they are doing all this to what? To gain attention, sympathy, and medical care. Okay, then these individuals can also move from hospital to hospital seeking treatment and attention. All right, so Munchausen syndrome, also called factitious disorder or Munchausen syndrome by proxy. Okay, so this behavior can lead to unnecessary medical procedures, and this can affect you. Imagine you are trying to actually say that force somebody to actually do a surgery for you for a disease condition that you don't have. Okay, this can lead to complications. Okay, so this can lead to unnecessary medical procedures, hospitalization, or even life-threatening consequences. Okay, so Munchausen syndrome is considered a mental health disorder, and the treatment typically involves what? Psychotherapy to address underlying emotional and psychological issues. Okay, because if somebody is trying to fake signs and symptoms for a disease condition, you don't go treating that disease condition, you treat their psychological problems that is making them do that. Okay, so it is important to note that Munchausen syndrome is different from what? Hypochondria. And in hypochondria, the individual is actually feeling the symptoms, though the disease condition is not there. Okay? So in hypochondria, the individuals genuinely believe they are ill from somatic symptom and from somatic symptom disorder, where the individual experiences what? Physical symptoms without a clear medical explanation. So if you or anyone is struggling with Munchausen syndrome, it is essential to seek professional help from a mental health expert. Okay, that's it about Munchausen syndrome, also known as what? Munchausen by proxy, and also known as what? Factitious disorder. Okay, so that's it, and I'll be seeing you guys in the next tutorial. Bye for now.